May is Mental Health Awareness Month, and this year, access to resources is as important as ever, if not more. Joining us now to talk about that is Dr. Jonathan Sherin, Director of Mental Health for LA County. And Dr. Sherin, good morning to you.
Good morning, Phil. It's good to see you.
Good to see you. But before we get started, we have to acknowledge on July 1st, you'll be stepping down from leading the Department of Mental Health. Can you talk a little bit about what led to that decision?
Yeah, absolutely. I mean, first off, if I might, I want to thank you, Phil, and ABC for the amount of coverage that you've offered around mental health. You know, during what I would call a perfect storm over the past several years. I mean, the importance of mental health has been known and rising in recent years, and then you have this pandemic, you have social unrest, and really a divided community. So your efforts to highlight things have been very, very important. My decision's based on a lot of things. I mean, for one, I have done a lot of the things that I wanted, and I feel very happy and proud of that. You know, the other thing is that a job like this really requires 200% every day, and I have given that. You know, last Monday I was out on the streets because I still do street psychiatry, and I saw some clients, and then I saw two people who have been housed who have been chronically homeless, and those are the kind of things that I actually will at some level miss the most. But when I think about the overall effort and the leadership role, I think about the analogy of birds. You know, birds fly in a flock, and there's someone there drafting others, and then you got to peel it off. So it's time for me to hand it over to the next warrior to carry the torch and push this mission in a heart-forward way.
Well, we are sad to see you go, but excited for whatever comes next for you. But to talk about today, when we start thinking about we've turned the corner on the pandemic, usually we get slapped back into reality. But why is mental health so important as we start to emerge from the pandemic?
Well, I mean, that's a great question. And as we all know, and we've been talking about here on ABC, the tidal wave of mental health and behavioral health needs is upon us, and will, in many ways, I would suggest, outlast the infectious virus aspects of the pandemic. So we've been really trying to build up our capacity for the entire collective, and that needs to persist. And the county and the Board of Supervisors know that and are committed to continuing to push, because as things change and as people reemerge, and we've got new patterns of behavior in business and really conducting the activities of our communities, it will put new pressures, and we have to go after them with the same type of collective effort. And that's, for me, the memo from the universe on all this stuff. Our interdependence is critical, and we have to work as connected people in order for us to really push through and address the mental health challenges that many of us will be suffering.
It's going to be hard to do this quickly, but I mean, we think about the pandemic ending, and then all of a sudden we're paying $7 a gallon for gas. So as you're mentioning, it's not always pandemic driven. Mental health stress can come in a lot of different places.
Yeah, it can. You know, and this is one of the big messages for me to the Board of Supervisors. Mental health has been, in some ways, a sidecar in the medical field for a long time. So we're way behind, just like we are with things like providing housing, in terms of having adequate capacity to provide services. And with the pandemic, which I mentioned, with social unrest, with this war, with all the financial, fiscal uncertainty that we face, these are things that are not going to go away, and there will be more and more stuff coming down the pike, and we have to get that memo. We have to leverage that silver lining right now, which is that so many people have been stressed and anxious and depressed. That needs to be taken seriously. For us to function as family members, at work, in the schools, you can't teach and you can't learn if you don't have mental health and emotional well-being. And that's the silver lining for me, and I would hope for our society going forward.
Well, Dr. Sherin, thank you. Great advice once again. Congratulations on your retirement. Surf's up. for you. Get out there on the ocean.
Yeah, you know it. I'll get in more than I had. And Phil, again, thanks so much to you personally and to ABC for all your coverage.
All right. We'll talk to you soon, I hope.
Yeah, bye-bye.
Speaking of